What's up, everyone? I'm Dr. Anthony with Superior PT, and today we're going to take you through an exercise called a hip car or a controlled articular range or controlled articular rotation. This is something I do with a lot of my patients who have back pain. Sometimes we know back pain can come from having really tight hips, so this exercise is geared at taking your hip through all of its ranges of motion and activating the deep hip rotator muscles at those end ranges. And this is going to improve mobility and control at those ranges, which should help with your back pain if that's what we found during our evaluation. Jesse here is going to be our patient. It'll really help at home if you have something to hold on to, whether that's a wall or a chair. We're going to use the GHG, something to hold on and stabilize to. So Jesse, I'm going to have you here from the side holding on to it. We'll use your right leg for this. So with our hip, we have three different motions that we're thinking about here. We have flexion extension, which is front to back. We have abduction and adduction, going out to the side, coming back in. And then we also have internal and external rotation. So we have 6 different combined motions. We're going to use this exercise to combine those motions together. We're going to make it one big exercise. All right, Jesse, you ready for us here? Ready. So what I'm going to have you do to start, I'm going to have you kind of bring your knee up to the front like you're a pitcher getting ready to pitch. Good. And then rotate your leg out to the side here, keeping that knee up. Good. And then when we get to the end there, it feels pretty tight. Go ahead and rotate your leg backward. Nice. If you see here, his knee dropped. If you can, try and keep it up, but Jesse's hips are pretty tight. And then go ahead and go towards the back of the movement. Good. And then down to the floor. So that's just the first half. So now we're going to go ahead and do the second half. So we're just going to do the reverse. So Jesse, go ahead and bring your leg backwards. Bring your knee up and out to the side. Good. If you notice he's going pretty slow, sweep the foot. Nice. And then go ahead and bring that leg in and then down. Typically, I'll have people do this 5 times, nice and slow. 5 going forward, 5 going back to the front, and then switch and do it on both legs. The leg that you're standing on is probably going to get a little bit of work too through your glute med stabilizing, and that's perfectly fine. Don't forget to like, share, and comment.